Christina Perry, and I'm going to be talking about weak primary health care around the world. So I have 10 facts about the state of global health care, and there are all written here, so I'm going to let you get a shot. Okay, so I'm going to talk about 2 of these. So number 2, most children's lives in developing countries could be saved if they had access to simple and affordable interventions. Along with this, 15 million babies, 1 in 10, are born preterm. Preterm birth complications cause 1 million deaths per year. Many preterm birth complications can be prevented with the right education and access, along with the vaccines that are talked here, that they could save so many lives in both children and adults. So along with this, I'm going to talk about how we can solve weak primary health care around the world. There's 3 things that we can do. First is education. If doctors and nurses in these developing countries have better education on what to know in order to help treat their patients with these preventable diseases, they can save so many lives. The next one I'm going to talk about is access. So if people in poverty, or like I said, in the developing countries or more in remote areas, have access to better primary health care, they also could be treated and be saved from many of these preventable diseases that I have also mentioned before. The third thing, which is crucial, is funds. Primary health care, any sort of health care, takes money, and if there are better funds for to provide better care and education from doctors and nurses, many people can receive the kind of treatment that they need, and with the money they can provide better access and education for those in poverty and in developing countries, and that is weak primary.
And my topic is antimicrobial resistance. Antimicrobial resistance is the ability of germs to fight against the drugs that are designed to kill them. So they become strengthened against antibiotics that are supposed to prevent them. Each year in the US, 2.8 million people are infected with antibiotic-resistant bacteria, which results in 35,000 deaths per year. The CDC has been identifying antibiotic-resistant bacteria since 1967, when they discovered a bacteria resistant to penicillin. The CDC, the Center for Disease Control, has outlined 5 things you need to know, which are these. But the most important of the 5 is that antibiotic resistance is the strengthening of germs against antibiotics, but it's not your body being resistant against antibiotics, it's just the germs becoming more strong. So those are the facts you need to know about antimicrobial resistance.
Hi, my name is Izzy Hurdle, and I'll be discussing high-threat pathogens. First, let's define what a pathogen is. It's a bacteria, virus, or microorganism that can cause a disease, and they're spread through multiple routes of transmission and spread very fast. The World Health Organization has a watch list of high-risk pathogens that scientists are currently working on to figure out vaccines, cures, or preventative measures, and these diseases include Ebola, Zika, Nipah, Middle East Respiratory Syndrome coronavirus, severe acute respiratory syndrome, and other hemorrhagic fevers. The World Health Organization wants the world to be better prepared to combat these diseases. In 2018, they named 2019 the Year of Action on Preparedness for Health Emergencies. This affects the future of nursing because all healthcare professionals will need to be trained in case a high-threat pathogen affects the area near them.
Hi, my name is Rachel, and my topic is vaccine hesitancy. And these are 4 main reasons why parents are hesitant to vaccinate their children. One is the desire for additional education, like they just want more information about vaccines, and they have safety concerns, such as they believe vaccinations might cause autism. And some people have religious beliefs, like they think that you can pray hard enough to cure diseases and prevent diseases. And there's also some other personal beliefs. Nurses are important in helping solve this issue because they can be the people that really do educate the parents and let them know the real risks and the real reasons why vaccinations are important.